Hello friends, today we are going to discuss about some research methods that are useful in assessing health needs in health practices. So before going to those methods, let us understand what do we mean by health research. Health research has been defined in relation to health generally as well as having an emphasis on health service. It has an important role in informing the planning and operation of services aiming to achieve health. The process for obtaining systematic knowledge and technology which can be used for the improvement of the health of individual groups. It provides the basic information on the state of health and disease of the population. It also aims to develop tools to prevent and cure illnesses and mitigate its effect and its attempt to devise better approaches to healthcare for the individual and the community. So now, as we know about the health researches, let us focus on understanding some of the methods that are useful for assessing health needs. So one of the most important research method that can be used in assessing health needs is called as epidemiological research. Epidemiological researches include both descriptive and analytic studies. Descriptive studies are concerned with describing the general distribution of diseases in space and time, such as cases includes case series studies and cross-sectional surveys. Analytic studies are concerned with the causes and prevention of diseases and are based on comparison of population groups in relation to their disease status or exposure to diseases. And some of these analytic studies examples include case control studies, cohort studies, experimental and other type of interventional studies. Now let us go deep into methods of epidemiology. First, let us start with understanding what are case series and case study methods used in epidemiological methods. With the case series method, a number of cases with the condition of interest is observed, often using triangulated methods like for example using questionnaire, data for records, observation, etc. in order to determine whether they share any common features or not. When it comes to in-depth studies of single cases, they are known as case studies. These are also useful for developing a body of knowledge about a situation and for paving the way for future trials of intervention and cohort studies of conditions. They have a long tradition in medicine and are valuable for describing new diseases and new side effects of treatment. Then we have surveys in epidemiological methods. Some of them are such as descriptive cross-sectional surveys. Descriptive cross-sectional surveys are based on a representative sample or subsample of a population of interest who are questioned at one point in a time. In epidemiology, the aim is usually to assess the prevalence of disease, associated factors and associations with service use. For the assessment of prevalence, these studies are sometimes conducted in two phases, in which a screening instrument like questionnaire measuring depressive symptoms etc. are used to identify people of potential interest who are then followed up and assessed in more detail. If we look into survey screening and case finding, we can see that cross-sectional screening and case finding surveys are conducted in relation to the detection of individuals or population at high risk of disease in order that there can be a healthcare intervention or health promotion in order to protect them, such as diseases considering cardiovascular diseases. Case finding is now more commonly carried out in opportunistic screening exercises like in situations of detecting of cases by questionnaire or record research among people attending a doctor's surgery for any other condition. Then if we look into ecological studies also aim to assess exposure or the risks and diseases or mortality. With these, the unit of study is a group of people rather than the individual, like for example people in classroom, hospitals, cities, etc. In relation to the phenomenon of interest, in contrast to individual studies where the unit of analysis is a geographical area or organization, individual level research can miss important area of influences and hence the unit of analysis in ecological study is the area level such as geographical or organizational. A limitation of this study is the assumption that the characteristics of a population, that is the study result, are applicable to the individual within themselves in the ecological fallacy. Now if we look into case control study, a case control study, also known as case reference study, is a descriptive research method which involves comparing the characteristics of the group of interest, such as a group with a specific disease like ischemic heart disease or who have been exposed to a particular risk factor such as radiation in a nuclear power plant incident cases. Now, if we look into research using documents, in epidemiology, or epidemiologists use official statistics, which they also call as vital statistics, on mortality variously displayed by socio-demographic factors, area mortality and occupational mortality, and morbidity, situations like cancer registration, congenital malformations. Now, if we look to another way of epidemiological research or survey, it is called as longitudinal cohort survey. These longitudinal cohort survey are also called as follow-up studies and are intended to assess the incidence of disease and the potential causative agents of disease in a population which divides itself naturally into exposed and unexposed groups. The term natural refers here to the fact that they are not artificially manipulated by the research design as in experimental studies. There are two types of longitudinal study. One is called as Pannel and the other is called as Trend. With Pannel surveys, there is no turnover of membership. However, account also needs to be taken of the time over which the survey members were observed, as well as the size of the population. With the fixed population in the Pannel survey, the population gradually diminishes in size as its members may die and cease to be at risk of becoming a case. Thus, epidemiologists often use longitudinal trend survey which are composed of dynamic populations, like there is turnover of membership and so on. Now, if we look into another approach called life course approach, it has been explained by Ku and his colleagues, and they have defined life course as the epidemiological study of long-term effects on later's health or disease risk of physical or social exposure during gestation, childhood, adolescence, young adulthood and later adult life. The aim of the study is to elucidate biological, behavioral, psychological processes that operate across an individual's life course or across generations to influence the development of disease risk. The ideal method uses birth cohort studies in which data is collected from birth and throughout the life. In practice, as with all longitudinal design, the survey rely on retrospective questioning at each follow-up phase and are subject to recall bias. Now, if we look to another method called as randomized controlled trial, also in short called as RCT, this is the ideal true experimental method for the evaluation of the effectiveness of health services and interventions in relation to specific conditions. The methods involve two or more groups who are treated differently, and random assignment to these groups leads to study or the method administration. These features requires the investigator to have control over the experimental treatment and over the process of random assignment between groups. The natural experiment, at a basic level, the experiment is a situation in which the independent variable is manipulated by the investigator or by natural occurrence. An investigation in a situation in which the experimental setting has been created naturally is known as the natural experiment. Natural experiment worldwide includes examination of the whole population, such as suicide rate, analysis of uses of health facilities, or to give birth in relation to cash incentives to use health facilities, and analysis of all cause and all specific mortality in population, etc. and so on. When we come to field experiments or trials are research studies in a natural setting in which one or more independent variable are manipulated by the investigator under situation as controlled as possible within the setting. Field trials usually involve the study of health individuals in relation to health outcome of preventive measures aimed at individuals, situations like supplementation of diet with vitamins, etc. Now, community intervention experiments or trials involve a community-wide intervention on a collective basis. With this method, entire community are selected and the exposure, like for example fluoridation, is assigned on a community basis. The community is defined either as a geographical community or as unit in social grouping, such as hospital wards, school classrooms, etc. Now we look into another important research method that is used in health researches. It is called as survey method. This survey is a method of collecting information from a sample of the population of interest, usually by personal interviews like such as face-to-face interview or telephonic interview. postal or other self-completion questionnaire methods, or diaries. The survey is distinct from a census, which is a complete enumeration and gathering of information, as distinct from partial enumeration associated with a sample. The unit of analysis in a survey is usually the individual, though it can also be an organization, and if organization were the sampling units like medical clinics, etc., or both of these in multi-level studies. A major advantage of survey is that they are carried out in a natural setting, and random probability sampling is often easier to conduct than for experimental study. This allows statistical inferences to be made in relation to the broader population of interest, and thus allows generalization to be made. This increases the external validity of the study. Now, after knowing the meaning of survey method, let us now know the various types of survey methods that exist. One of them are called as descriptive surveys. Descriptive studies literally describe the phenomena of interest and observed association in order to estimate certain population parameters like the prevalence of falls among elderly people, or for testing hypotheses like the falls are more common among people who live in homes which are poorly lit, and for generating hypotheses about possible cause and effect association between variables. They can, in theory, range from the analysis of routine statistics to a cross-sectional retrospective survey, which describes the phenomena of interest in the population and examines association between the variables of interest. Descriptive studies cannot provide robust evidence about the direction of cause and effect relationship. However, the increasing sophistication of statistical techniques can help to minimize the limitation. Descriptive studies can still provide information about social change. For example, health services are increasingly encouraged to shift resources and services for the hospital sector to the primary care sector or not. Then we have another form of survey called as analytic survey. Here, longitudinal surveys are also called as analytic rather than descriptive, because they analyze events at more than one point in time rather than cross-sectionally. Then we go to another method of survey called as retrospective or ex post facto and cross-sectional surveys. These are descriptive surveys of a defined random cross-section of the population at one particular point in time. Most cross-sectional studies are retrospective. They involve questioning respondent about past as well as current behavior, attitudes and events. Cross-sectional surveys using standardized methods are a relatively economical method in relation to time and resources, as large number of people can be surveyed relatively quickly and standardized data are easily coded. The method is popularly used in epidemiology to investigate the prevalence of diseases. For example, the population is surveyed at one point in time and the characteristics of those with diseases are compared to those without the diseases in relation to their past exposure to a potential causative agent. Retrospective studies are frequently criticized because they involve retrospective questioning. For example, respondents may be asked questions about past diet and other lifestyle factors, and the potential for selectivity in recall and hence recall bias. Great care is needed with questionnaire design and the time reference period asked about in order to minimize this bias. However, retrospective studies can provide useful indications for future investigation. Another form of survey is called as longitudinal prospective survey. The longitudinal prospective survey is an analytic survey that takes place over the forwarded passage of time prospectively with more than one period of data collection, that is longitudinal. The longitudinal survey is a method commonly employed by epidemiologists for situations to measure the incidence of disease and cause and effect relationship. Prospective longitudinal studies require careful definition of the group for study and careful selection of variables for measurement. These methods is of value for studying the effects of new interventions like, for example, national health education and their promotional programs. Now we come to another way of survey, that is by using secondary data analysis. Secondary data refers to existing source of data that could be used for research purposes. The source includes routinely collected statistics from the hospital, primary care and community health services. It also uses disease registers, population mortality, birth, death, historical records, medical records, existing morbidity data, and existing population research data that has been lodged in data archives. Secondary sources of data are usually very large data sheets. However, they can be relatively economical to analyze in comparison with primary data collection. Then another form of survey is called as trend survey. A trend survey is a representative sample of the population of interest at the outset of the study, and in order to take account of changes in the wider population over time, to draw a new sample at each future measurement point. This method used by epidemiologists in order to identify sample members with differing levels of exposure to a potential disease and to enable incidence rates to be calculated. Then another form of survey is called as panel survey. A panel survey is the traditional form of longitudinal design. A sample of a defined population is followed up at more than one point in time, that is, such as repeated questionnaire given at various interval over time, and changes are recorded at intervals. Although the wider population may change over time, the same sample is interviewed repeatedly until the study terminates or the sample naturally dwindles as sample members have left. Again, the sample members should be derived from a random sample of the population. It can be based on a cohort sample. Information is sought from the members by post or by interview method. This is a common method used to analyze changes in emotional well-being, social network and support, psychological morbidity, physical functioning, and services over time. Then we go to another form of study called as cross-sectional and longitudinal cohort study. When the population to be sampled has a common experience or characteristics which defines the sampling, like all are born in the same year, it is known as cohort study. The key defining feature of a cohort is the sharing of the common characteristics. A birth cohort, for example, can be a sample of those born in a particular year or in a particular period, such as 5 or 10-year period. A cohort study can be based on analysis of routine data and or assessment and data collection for the study. Technically, cohort studies can be cross-sectional and retrospective. The prospective cohort study is one of the main methods used in epidemiological researches to investigate the etiology or the cause of disease. Then we have another form of study called as cohort sequential study. Some longitudinal cohort design involve taking cohort at different points in time. For example, sample of 18 to 25 years old in different years, in order to allow for cohort effects, that is the sharing of common experience which can lead to the unrepresentativeness of the cohort. These are known as cohort sequential studies, and cross-sectional and cohort sequential analysis can be carried out. Now we looked into another important method of researches, that is called as experimental method. The experiment is a situation in which the independent variable, also known as the exposure, the intervention, the experimental or predictor variable, is carefully manipulated by the investigator under known, tightly defined and controlled condition or by natural occurrence. At its most basic, the experiment consists of an experimental group which is exposed to the intervention under investigation and a control group which is not exposed. There are various types of experimental methods that can be used in health researches. One of them is called as the true experiment. Two features mark the true or classic experiment. Two or more differently treated groups, that is experimental and control, and the random, that is chance assignment or randomization of participants to experimental and control groups. The other factor that has to be taken care is timing of follow-up measures. As with longitudinal survey, the timing of the post-test in experiments needs to be carefully planned in order to establish the direction of observed relationship and to detect expected changes at appropriate time period. The other factor that contributes to experimental design is sample attrition. Sample attrition refers to loss of sample members before the post-test phase, which can be a serious problem in the analysis of data from experiments. The similarity of experimental and control groups may be weakened if sample members drop out of the study before the post-test, which affects the comparability of the group. So, sample attrition has to be taken care by selecting sample members who will not leave the test before the post-test phase occurs. Reducing bias in participant and the investigating team is another important factor that has to be taken care while doing experiment. If a patient in a clinical trial is aware that he or she is receiving a new treatment, there may be a psychological benefit that affect his or her response. The reverse may also be true if patients know that they are receiving standard treatment and others are receiving new treatments. The treating team may also be biased by the treatments. For example, if patients are known to be receiving a new treatment, they may be observed by the clinical team more closely, and this can affect the patient's response to treatment, and hence the result of the trial may be biased. Then another way of doing the experiment is by using a placebo group. It is used to describe an inert treatment given to a control group against which to measure the effectiveness of the active treatment given to the experimental group. It aims to make the participants' attitudes in each group as similar as possible. The investigator needs to demonstrate that the intervention, that is the treatment, will lead to greater response than would be expected if it was simply a placebo effect. Then we go to another form of experiment called as blind experiment. It is known from studies in psychology that investigators and also treating practitioners can unconsciously influence the behavior of the participant in the experiment, both human and animal experiments, by, for example, paying more attention or being more positive towards one participant, like for example smiling towards them, or to the members of the experimental group. The method for dealing with this are maintaining the ignorance of the participants or professionals, example treating practitioners, and assessors about which group the participant has been assigned to, known as blinding or masking. And the assessor's effects are eliminated by excluding personal interaction with the participants. For example, they receive standardized letters, written or tape recorded instructions, and self-completion questionnaires. Ideally, then each participant is blind and none of the directly involved parties know which group the study members have been allocated to, study group or the control group, in order to eliminate bias from the assessment. This is known as double blind trial. But if the investigator and not the participant knows the allocation, this is known as single blind trial. When all the parties are aware of the allocation, the study is described as open. Blind studies are easier to organize for drug trials, like such as where pharmacists can arrange drug packages for randomization list, or sealed envelopes containing the drug's prescription can be used. Now we come to another method, important method in assessment of health needs, that is called as clinical method. Clinical research is a branch of medical science dealing with any research or study in living humans. It is a branch of medical science that determines the safety and effectiveness of medication, devices, diagnostic products, and treatments intended for human use. These may be used for prevention, treatment, diagnosis, or for relief of symptoms in a disease. Clinical trials is the term interchangeably used with the term clinical research or clinical study. Clinical trial is defined as a systematic study of new drugs in human subjects to generate data for discovering and verifying the clinical, pharmacological, pharmacodynamic and pharmacokinetic and adverse effects with the objectives of determining safety and efficacy of the new drug. Clinical trial is company sponsored, meant for a new drug or devices and carried out for a specific new use of an intervention, while clinical research is meant for academic and pharmacovigilance. Large number of literature describes on clinical trial and its phases. However, it has been now started also to include a detailed description on clinical research or clinical study methods to interpret the result of the study. Clinical research helps patients and the National Health Service providers by providing insights into the following areas, such as diagnosis. How are diseases and conditions diagnosed? Do they run in family or there are other ways to diagnose them? Second is cause. What causes a disease? What are the links between lifestyle and other conditions that causes a disease, such as known as comorbidity? How should disease best be treated or cared for? How can we best organize care and support? What help patient respond to care and self-care? And the next one is cure. Can we cure the disease or can we stop it from coming back? Now, after knowing or having the general overview of clinical research method, let us talk about the phases of clinical trial or clinical method. Clinical trials evaluate the effectiveness and safety of medication or medical devices by monitoring their effects on large group of people. They are generally developed along the following lines, such as phase 1, also called as human clinical pharmacological trial. These trials investigate the therapy in a few research subjects who are healthy volunteers. These trials assess safety, tolerability, and how the drug works in humans. These trials are not carried out in healthcare setting but tightly controlled clinics within 24-hour medical attention, where the therapy too toxic for healthy subjects, like for example some cancer medication for instance, are performed in patients with diseases only. Phase 2, exploratory trial. These increases our understanding of the study about drug safety and effectiveness in a controlled setting to decide on doses. Generally, there needs to be more than 100 patients to demonstrate the relevant result and define an appropriate patient population to do the further studies on. Phase 3, confirmatory trial, only done once the treatment is deemed potentially safe and effective. These are much bigger studies involving 1000+ research subjects, usually undertaken in healthcare settings such as clinics or hospitals. These trials are more real life and need to represent normal population to be useful in practice. Usually, a comparison is made with standard treatment or a placebo. It is imperative that the drug is shown to be effective and safe in this phase. Phase 4, randomized control trial, at which people are randomly allocated to receive or not receive an intervention or treatment and then followed to determine the effect of the intervention. The 2 or more groups should have similar types and numbers of people in them. Having a control group allows researchers to assess if the results at the end of the trial would have happened by chance or if the treatment intervention was actually having an effect. Now let us look into some of the clinical research methods. One of them is called a systematic review, a critical assessment and evaluation of existing research, not simply our views or summaries, that attempts to address a focused clinical question using methods designed to reduce the likelihood of bias of the overall finding is called a systematic review. Another type of clinical method is called as cohort study or case control study. These are either looking back over patients' records to see what has happened to them or following a group of people over time to see what will happen to them. Another form of clinical method is qualitative research. These studies are often about understanding better what it is to live like with a condition or a disease and how people feel about their care and treatment. It can be highly interactive with people by doing interviews, discussion groups, etc., or it can be more observational. The next one is called as research outcome. These can be things that may be measured, such as thickness of skin, spreading of rash, blood pressure, etc. Or they can be assessment of feelings and moods using questionnaires, for example, or they can be statistics such as death, birth, time taken to recover from operations, for example. Ideally, research outcomes need to work for researchers and study participants, but it also needs to be recognizably important from patients, carer and clinical viewpoints too. Now, with this information regarding the various research methods, I hope you have a better understanding of the ways to assess the health and illness factors and needs. Thank you.